So after 8 p.m. when the front doors close, this will become the only access into the facility. We will have security located here 24/7, and so security will then screen patients, those that will be coming into the emergency department or those that may be having to access the remainder of the hospital. So once it is determined that patients are for emergency, then the door will be open and patients will be allowed through here. And we have 2 registration cubicles, and then patients will proceed then over to the triage desk. Here then, the triage nurse determines where the patient will be taken. We categorize all of our patients from a 1 to a 5 when they present according to their level of acuity. And so if you're less urgent or non-urgent, we could utilize that area as a fast-track area to sort of facilitate patients being seen by a physician. Right now, we have a third physician that comes in from 2 o'clock in the afternoon until 10 p.m. to work in the streaming area. And so 2 emergency physicians are looking after the patients in the department, but triage will send some of them into the streaming area here. So the doors would be open then, and patients would either be sent down this corridor or around down the other corridors. This is where the emergency personnel are working. Now, the adult trauma rooms are here. These are really 2 treatment rooms that can be opened up and combined into one. We have a mechanism here and across in the other 2 resuscitation rooms it's a patient lift. And so more and more, we're utilizing equipment so that, we're minimizing injuries to staff. Yes, so that, we have slings and ways of transferring patients now. This is the room that we would use if we had a patient or patients arriving after contamination with hazardous materials. And in our ambulance garage, we have the capacity to have patients shower and decontaminate. And then they would come in via the ambulance garage and the back into this treatment room here. And so without contaminating the remainder of the department, we are able to facilitate them. Specifically designed for treatment of our sexually assaulted patients. There will be specialized equipment housed here. And in the back, very nice, large, private washroom and shower facility. This is one of 3 areas then where recliners will be housed. And this particular room will have 4, 2 on this side, 2 on the other side. This could be for patients who have been assessed, perhaps are awaiting diagnostics of some kind, or perhaps just need some intravenous therapy. And so they're relatively well, they're mobile. We have set this up as what we call a seclusion room. We've not had one in past, and so we're just working out the details of how we would manage this room. But as you can see, it's very sparsely furnished, and one would assume that there would be just minimal equipment in here, perhaps even just a mattress of sorts. But this would be for a very disturbed individual who we're paying very close attention to.
Fresh space.
We have 3 isolation rooms. Yes, and 2 of them will be on what we're calling the emergency side, and 1 will be located back in what we are calling the reassessment unit. Patients requiring up to 24 hours of intervention and care are officially admitted to the reassessment unit. Then they're either reassessed and sent home, or they're admitted to the hospital. This is a service that we've had in place for quite a number of years.
Overall, we're expecting just a much better experience for the people that need emergency health services in Regina.